we'll start with what is CPHQ, what are the benefits, what are the modules. Then we will cover the healthcare data analytics module, because that's the most difficult module. People generally, find it very difficult. So our specialty is that we prepare you well for this module, so you don't fail. And mostly, if you are very good in healthcare data analytics and also process improvement techniques, and we are well known for this particular part. If you go through this, if you are mastering this module, you will definitely not fail. Yeah. We'll take some project example, maybe from a hospital on process improvement, so that some of the concepts are clear. And if there are something which we can discuss, why not? About the organization, we have been training individuals and corporates and hospitals, clinics, then labs for the past 17 years. And right from US, UK, National Healthcare Service, they are also our client. Ministry of Health of Saudi Arabia. I'm right now in Qatar. At this point, I'm just traveling. There's a hospital called Sidr Hospital. We have done training, CPHQ training there also. Lots of King Fahd Medical City, health ministers of Saudi Arabia, deputy health ministers of Saudi Arabia, they have attended our training. Dr. Tarif Alama, Dr. Muhammad Abdul Ali, we are always proud to tell that they have been our course participants. And we have got worldwide batches, both in the classroom, offline. I also take pride in telling in 2007, I was the first person to conduct the Lean and Six Sigma Black Belt training, which is highly statistically oriented training in anywhere in Middle East. First time Black Belt session was conducted. I had done it, by the way, in King Khalid hospital. See, those days I had a little bit of hairs on my head. So 15, 16 years ago. And this was people from a lot of hospitals, KFMC and King Fahd Medical City, King Saud Medical, KSQMC, so many, International Medical Center, people had attended. And since then, I have been doing these trainings worldwide. This is Chinese hospital, Beijing hospital, then multiple locations, multiple places, a lot of awards in different forums. I have been a 10-time speaker for Hospital Management Asia and award-winning speaker. And this is a National Healthcare Service who are our client, where we do a lot of quality-related training, CPHQ and Lean Six Sigma Green Belt and Black Belt. Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Yes. And then again, a lot of trainings modules for CPHQ and quality-related modules for Mr. Andrew Robertson with us, who's CEO of King Edward VII Hospital in London. And we have a lot of credentials, appeared on TV programs and Z-Business.
I am Shekhar Suman, and I
had a lot of fun on his TV show. Those who are from India, they may know. ASQ Quality Conferences, I have been a regular speaker. On 21st of May, 2000. I've also written a book. And I was talking, we take pride in telling Dr. Tarif Alama, who had been with us We have Dr. Tariq. So he's the Deputy Health Minister of Saudi Arabia. And also Dr. Muhammad Abdul Ali. So we have got lots of credentials, a lot of people.
Just finished the course, the Six Sigma.
So I have been doing, Lean Six Sigma and CPHQ courses for hospitals. And let me talk about what is CPHQ. CPHQ is a exam conducted by NAHQ. So when we conduct the training, if you attend our training for 5 days, you get one certificate, which is so as I was telling, those who have joined late, I see a lot of people have joined late. Let me go back a little bit. And I just wanted to check, and my team can write in the chat box, is my the connection okay, right? Because
yes, everything is fine.
I'm just landed in Qatar for a hospital here. I'm conducting a CPHQ training for them. So I'm from hotel. I've just logged in from a hotel. I'm staying in Hayat. Anyone in Qatar, just let me know. I'll be happy to meet you. I'll be happy to meet you. And some people, so connection is okay in Qatar. Yes, Muhammad Ahmed is writing. Yes, great. So so you will. So I was telling that we conduct a CPHQ training course, and today we are going to tell you what are new things in CPHQ. Those who have never heard of CPHQ will tell you what is CPHQ, and we'll also cover some modules. We will give you some. Today you are going to take home at least 10 to 12 tools which you can apply to your clinics and hospitals immediately. Next week itself, you can use some of these tech tools and techniques and do little wonders. Okay. So I will be conducting training for root cause analysis. Okay. We'll take some example in a hospital. We will try to think of solving a problem in a hospital, common problem in a hospital. I remember Sultan Qaboos University Hospital in Oman, in Muscat. We did a patient discharge time. That was in 2011 we did. Patient discharge time reduction. And the same thing we repeated in King Fahd Medical City, King Saud University Medical City. Then we have so many hospitals, So, Cedar Hospital also, yes. Thanks to, I see 4 or 5 people who have been my students in Cedar Hospital. They are also here. A special hello to them. Okay, great. We as I was talking about, we'll talk about CPHQ. Then we'll talk about data analytics module, which is considered to be the most difficult module. So I will teach you some basic things in data analytics and FMEA, failure modes and effects analysis. And some of you might have heard of FMEA. I may not be able to give the full training because it takes a little time. And with an exercise. So I'll give you a link and you can always watch that link and use FMEA in your clinic or a hospital or a lab immediately. Next week itself just takes 2 hours to do an FMEA, failure modes and effects analysis. It's a tool where you imagine how you will fail. Yeah. So these are the agenda points. And I was just introducing myself. So those who have missed, don't worry. And I just introduced myself. Nothing. Now we are starting. Yes. So CPHQ. So CPHQ is an exam conducted by NAHQ, and if you pass that exam, you can write CPHQ after your name. And also, if you don't want to appear for the exam, you still get a CHQ certificate from AEC Europe. Which is CHQ is Certified Healthcare Quality Expert. So if you attend the session, you become certified. It means if you don't want to, even till the time you write the exam, you are a CHQE, and then after that, and that is from AEC Europe, and then CPHQ from NHQ if you write the exam. And we prepare you well for CPHQ examination. Okay, great. So I think my team has go ahead because now enough people have joined in, and we talking about the module. What are the modules? Now, let me tell you, let me open. I will just open from the So any questions you can also ask me. Okay, so Hanan is asking, is there any certificate for this program? Yes, you can get a certificate. Introduction, CPHQ introduction certificate. For this program also, you can get a certificate. Okay, great. So there are 6 modules. Okay. There are 6 modules. And what we cover during our sessions, let me tell you. So on the day 1 of our training, and this is all coming from NAHQ, right? So this, whatever we are doing, it is all based on NAHQ's NAHQ syllabus for the CPHQ. So quality leadership and integration, we talk about strategic planning. We talk about advising leadership on organizational improvement opportunities. So I'll give you a glimpses of what do we mean by systems thinking. How can a certified professional in healthcare quality assist in the development of action plans or projects which are going to improve the quality of the hospital, and how can you assist with establishing the priorities and participating in the activities that support the quality governance structure. So if you change the culture of your organization, half of the job is done. So how to change the culture and bring in quality culture in the hospital or your clinic or your lab, and how can you align quality and safety activities with the strategic goals. So these are some of the things which usually are part of the strategic planning, how to make strategic goals, how to integrate quality into your strategic plan of your organization. Then how to engage the stakeholders. So right from the senior management to all the employees in our organization, you have to develop that culture of quality and safety. That requires engagement of the stakeholders. So how is it possible to engage the people? So there are a lot of tools, a lot of techniques which you generally learn in the stakeholder engagement module. After that, we also talk about the performance and process improvement. So here, importance of the quality improvement training and the communicating the quality improvement information within the organization, and then doing projects. See, anything you want to improve in a hospital or a clinic or in the organization, you have to use project approach. So what is a project approach? How to do projects in teams, various performance improvement tools like Lean, PDSA, Six Sigma, etc. You learn about them. Then you use quality tools and techniques like fishbone diagram, FMEA, process map. So we'll try to cover some of these tools and techniques today in our session. And so that's what I've chosen, say performance improvement. So I will teach you, tools and techniques of leadership a little bit. Tools and techniques of performance improvement a little bit. Maybe half an hour I will devote to, in half an hour to all these modules. I'll be picking up some tools and techniques from each of those modules and tell you that what is in store for us in CPHQ training programs. Then we also cover the population health and the care transitions. So identifying the data and resources that are important in determining the health status of the defined populations. Then identifying the population health management strategies to integrate into improvement initiatives. So a lot of statistical tools and techniques are very much part of our CPHQ syllabus now. How to incorporate techniques to address health disparities and promote equity into improvement initiatives. and analyzing and using clinical cost, equity, and social determinants of health data to drive and monitor improvement efforts, and identifying the opportunities for improvement in care transitions. These are all, actually, this particular module is a new module, which was not there last year. And we've emphasized on these modules also. Incorporating the concepts of social determinants of health into improvement activities. So now I'm just listing, and then we will start covering one by one. I will give exposure to all these modules one by one in the next 1.5 hours. Then we'll learn about healthcare data analytics, how to design the data collections plan, what are different types of data, what are the tools and techniques to use the data, sampling methodology, and how to identify and select the measures, structural measures, process measures, outcome measures, experience measures. Again, coming from Donna Bedian, who was the quality group, then collect and validating the quantitative and qualitative data, identifying external data sources for comparison and benchmarking. So these are all topics related to data analytics. Then we have got measurement and analysis, how to analyze the data, how to visualize the data, how to display the data. Bar chart, histograms, line charts, control charts. So I'll give you a little bit of glimpses. Then using statistics to describe data and determining relationships, measures of central tendency, mean, median, mode, standard deviation, correlation, regression, hypothesis tests. Those who have attended my Black Belt training program earlier, they are already aware, and special welcome to those people who have already been our students. I see around 20 of you who have attended our Green Belt and Black Belt earlier. Special welcome to all of you. So you can realize there's a lot of overlap between our Lean Six Sigma Black Belt training program and what is covered in the CPHQ. So half of I can say that if you have attended our Black Belt training program, you have already covered half of the syllabus. Then what is special cause variation, common cause variation, control charts, trend analysis, comparing the data sources to establish benchmark, then determining the data to support decision making. And then we talk about the patient safety. So these are the topics covered in the patient safety, where identifying the technology solutions to enhance patient safety. And here is that tool called FMEA, failure modes and effects analysis, using safety principles like human factors engineering, high reliability, high performance teams, systems thinking, and safety event or incident reporting, root cause analysis. So these are the tools which I was just going through the whole syllabus right now, and I will take you through some of the topics from each module one by one now. So let us say, as I told you today, I'll emphasize on the data analytics and process improvement parts, which are the most difficult modules in CPHQ. And most of the people, if they, sometimes people do fail in the CPHQ examination. So most of the people actually fail in those two or three modules. So I will talk more about it today from that perspective. Regulatory and accreditation, how to get accreditation, what is the accreditation journey, how to prepare for the survey. Some of you are our clients, and there's a software tool called AcriPro, which I'm a co-founder of another company, also AcriPro, which is into developing the accreditation software. So Sabahi, JCI, the accreditation, how to get the accreditation, how to prepare for those accreditation, whole process of getting accreditation. That is also part of the syllabus of our CPHQ module. So now let us start. So to best learn about quality tools and techniques, we'll imagine that we are trying to solve a problem. We'll imagine that we are trying to solve a problem in a hospital, and we'll take a case study, and as we solve the problems in our hospital, we will try to we will try to use those tools and techniques. So the whole idea is to take you through the journey of the tools usage when you are trying to improve anything in our organization, and whenever we are trying to improve our organization, how to select the right tools, how to develop the right mindset, and how to use the tools like control charts, root cause analysis, cause effect diagram, Pareto chart, and if time permits, even FMEA, as I told you. I think I should be able to cover the FMEA part as well. Now let us let me cover some of the basic stuff. First, let us start with the leadership. Okay. So leadership part is about systems thinking. So when you talk about, whenever you want to bring in a cultural change in your hospital, it starts with the leadership. And leadership starts with systems thinking. All of us are leaders in our own respect. It's not that only the CEO or the COO they have they have got the responsibility of leading. In fact, each one of us are leaders. And so even if you don't have any reportee, if you don't have any team member, also still you are a leader. Because you are also influencing the culture of the organization. So what is systems thinking? Systems thinking is about developing a system of thinking as a whole. So you should think about your organization. Think about your organization. And let me take you through a systems thinking model of Deming. Dr. Edward Deming, he was a great quality guru. And he used to say, in fact, he was the first person to say that leaders should have systems thinking. And he also used to say one more thing. In fact, 3-4 very famous sayings are there of Edward Deming. The one is, of course, leaders should have developed systems thinking. Second, very commonly quoted is, the problems are in the processes, not in the people. Means 85% of the problems, to be very specific, he said 85% of the problems are due to the processes and systems and not due to the people. So if you want to change something in your clinic or a hospital, you have to change the processes. The same people will deliver excellent results. Okay. So what do you mean by systems thinking? So think about your own organization. Our organization actually follows our organization, we end up doing lots of repetitive steps. These repetitive steps, whenever we repeat something again and again, we call it as a process. So we have step number A, B, C, and D. Some examples of process could be patient treatment process. Patient treatment is a process. Patient discharge, discharge of the patient is a process, discharging a patient from hospital I'm talking about. So that is also a process. Similarly, performing a surgery, that's a process. So in any process, you have steps which you keep repeating again and again for a long time. That is repetitive process. That is what is known as like this. I keep doing 1 time and 2 times and 3 times and 4 times again and again. If I keep doing something, we call that as a process. And process always delivers an output. Okay. Process always delivers an output. An output could be in the form of a product or a service. Product or a service. Okay. This output goes to a customer. This output, it goes to some customer. right? And the customer gives a feedback to a team in our organization. So strategic planning team, board of advisors, any team which is responsible for creating strategy organization. So taking the feedback from the customers and also sometimes the demand of services from the customer. Like I'll take an example. During COVID, you had got we used to predict the demand, okay, demand of our services. So in this case, predict based on the predicted demand and based on the feedback of our services from the customers. See, customers could be patient, customer could be relatives of the patient, customers could be Ministry of Health. Yeah. So there are different customers. Customers could be internal, customers could be external. So I'm talking about, like, if I'm taking the system of a hospital, then customers would be the patients or the Ministry of Health. And if I'm talking about a particular department, see, system map can be developed for a department also. So if I'm talking about a department, let's say a process of in a lab, let's say. So I'm generating reports. So a blood test report, let's say. So blood testing, the blood is one process. And again, this whole system even fits into that process also. So the system, when I'm talking about, I'm not talking about only the hospital. The system map could be for a department also. So strategic planning team will advise the suppliers. Yeah. Suppliers to supply the relevant raw materials and inputs. Raw materials and inputs. Inputs are the processes. Inputs are processed and they are delivered as outputs to the customer, and this whole process goes on and on. So this whole process keeps happening again and again. And if there is smooth flow of these process execution in our system, we say that our system is healthy. But if there are interruptions, if there are blockages, let's say B is fast, but C is slow. So then you will see a lot of waiting time in the system. A lot of work in inventory stuck in between, which we call it inventory, work in process inventory, stuck in the whole process. So all these things are going to make the process unhealthy. The way, as a human being, if you look at our health, if our breathing is smooth, normal, we are healthy. But when we are unhealthy, the first thing what gets affected is the breathing. Similarly, if there is a continuous flow of inputs being processed, delivering the outputs, going to the customer, and we are getting the feedback, and we are making our plans accordingly, and if this smoothly flows, we say our system is healthy. But when this flow is not smooth, then we say that there are diseases in our system. And how do they manifest themselves? How do they reveal themselves? The disease of our system is revealed as patient complaints, patient dissatisfaction, or customer complaints, customer dissatisfaction. Customer could be a Ministry of Health also. Delays, errors, rework, all these are examples of unhealthy system. And as a leader, I have to understand that I am responsible for the system's health. And this is known as systems thinking. So as a leader, you are responsible for giving strategic direction to your organization. And how do you do that? You start with a vision. So whenever we are talking about leadership, these two terms you will be encountering most of the time. Vision and mission. Mission means how do you see your organization after a certain time. Mission means what is the purpose? What is the purpose of your existence? So purpose of existence is mission. Purpose of existence is your mission. And vision means how do you see yourself? How do you see yourself after a certain time? Vision, 2030 vision, 2035 vision means by 2025, my hospital, child pediatric hospital, is a vision. Mission is to take care of every sick child in the city. Or mission will be to alleviate suffering in children. That could be a mission. Mission generally remains the same. It doesn't change often. It remains for a long, long time. Vision keeps changing. Vision means, 2025, your vision would be different. 2030, your vision would be different. So vision keeps changing, but mission remains constant. So as a leader, you have to develop the vision. As a leader, you have to be aware of the mission of your organization. And based on that, I create our strategic goals, strategic plans. What will make me number one hospital by 2025? So what are the things I should be doing in the next 2 to 3 years? Okay. So you will first assess your own position. Where are you today? What are your capabilities and what you need to do to achieve your destination? And you create a strategic plan, etc. You find that you create some plans. That's what a leader is supposed to do. And if your vision is clear and if you are able to share the vision with your team members, that means you are a great leader. And that's what is expected. So this was very brief about the leadership. Today I'll be talking briefly about each of the modules. So this was about the leadership module, the first module of CPHQ. And we tell you how to develop the strategic plans. We give you some examples of a balanced scorecard. What do you mean by Hoshin Kanri? There are a lot of good tools which will help you to become a great leader and also establish quality culture in your organization. Now let me go to the next one. So this was about leadership. There is a very good video which I have created about 5 levels of leadership. There's not much time to play this video, but I will request my team to put this in the chat box. This leadership the 5 levels of leadership talks about the 5 levels of leadership given by Mr. Maxwell, and he's a leadership guru, in fact. So John Maxwell's 5 levels of leadership is one thing which I request you to just go through this particular video. In this video, if your actions inspire others to dream more, learn more, do more, and become more, then you are on the path to becoming a great leader. In this generation where technology has become so advanced that it is available to everyone, the only competitive edge a company can get is by improving its leadership. How important a good leader is can be explained using the examples of many companies that rose to skyrocketing highs. As I told you, I'll be leaving you with this video, and please go through the video. There's a 5 levels of leadership, and where do you belong? You can determine your own leadership as well, because the level your organization can achieve is actually decided by the leadership level. So if you are, let's say 5 levels are there of the leadership and you are at level 3, so your organization can never go beyond the level of the leader. So everyone will be stuck at level 3 position. If you are at level 4, so you will also take the hospital or your clinic to the level 4. So you can't go above that. Your organization can't go beyond the leadership level. So as a leader, you have to raise your own level. That's what the essence of that video is. Please go through that video. I'll leave you with that video. My team will has already put that in the chat box. And please store these. I strongly request you to please store these links and go through these links after the training. Okay, now let me talk about some of the basic concepts of hospitals, lean in hospitals. See, our hospital is about high volume, high variety, high variation, high speed, high stress, high turnover, highly regulated. One of the highest regulations are stored for the care system, right? So it leads to often service breakdowns, wasteful processes, and medical errors. So we are talking about now. Let's talk wasteful processes. So what are some of the basic lean concepts? It is about war on waste, trying to identify the wastes in our system and eliminating them as much as possible. Processing, motion, walking, searching, waiting, transition, supplies, capacity, inventory, man hours, production. So these are all hidden wastes in our systems. The 7 or 8 popular wastes are intellect, waste of intelligence, scrap, waiting, inventory, motion, transportation, overproduction, overprocessing. Some of the wastes are obvious, but many of the wastes are hidden. So we are talking about the hidden waste like overtime, overstaffing, rework due to errors, subsidies. If I take a simple example of a blood test, there are many steps involved in that. But what are value added and what are non-value added? In Japanese, we called the non-value added steps as muda. Muda means waste in Japanese. So what do you call it as a waste? Waste is something which the customer is not willing to pay for, not willing to pay. And so value added activity is any activity which the customer is willing to pay for. And non-value added activity or muda or a waste is something what the customer is not willing to pay for. The second part is you should do it right the first time. So anything which is not done right the first time, that is a waste. So if you commit a mistake and then you rectify that mistake, committing the mistake and wasting the resources of our organization is a non-value added activity, muda. That is a waste, isn't it? So customer should be willing to pay for, it should be doing right the first time, then it's value added. And the third thing is, it should transform the input So in this case, if I'm defining waste, then it should say it does not transform. It does not transform the input and bring it closer to completion. Means any step which is not taking you towards completion of what your objective is a waste. Okay, so let us take some examples. Some examples will help you to understand. So walking to the OPD. Now you may say that, yeah, it is required to walk to the OPD, but from customer's perspective, from patient's perspective, what is the value addition patient is looking at? Patient is looking at knowing the health status. In fact, physician is also a customer here. So physician is interested in knowing the health status of the patient. Now, walking to OPD is not adding any value. Please remember, walking to OPD is not adding any value. Registration is not adding any value directly to the customer. Think about value from customer's perspective, not from your perspective. So in this case, we will say that only two value-added steps are there, drawing the blood and processing the blood test. That these are the two value-added steps, and remaining are non-value-added. So we need to reduce them as much as possible. We can't eliminate, given the technology constraints today, we cannot eliminate that, but we can definitely reduce them. So trying to achieve this reduction of muda or the waste in our hospital is lean. I'll talk about a little bit of other techniques, PDCA, Six Sigma, FME also, but we will go one by one. I'll tell you, these are the wastes in our system: waste of intelligence, waste of rework defects, waste of waiting, waste on inventory, waste of motion, waste of transportation, waste of overproduction, waste of overprocessing. So let me give you some examples. Waste of intelligence. Now, many times you will see that patients call the nurse for some simple things, that why my bed cover is dirty, my pillow is not okay. Now, this is waste of intelligence of nurse. If you ask the nurse to get involved in all those other activities, she will forget to give you the medicine. Means if you involve a person in non-value-added activities, the person will not be able to, or the focus of that person will reduce while delivering the value. So involving a person in activities which can be done by someone else, not using the person's intelligence to his own capability, that is known as waste of intelligence. Now, these are all hidden wastes, and these are often ignored wastes. So this is something, you need to take care of. There are so many examples. I've just pulled out some of my material, from our CPHQ training, and I'll just go through. I'll pick up some of the examples, some of the topics. Let's take an example of this hospital, which doubled its cardiology lab capacity from 8 to 16 by just redesigning the work without adding more staff. In a single day, the capacity was doubled. Again, applying these principles of process improvement. In one hospital, patients had to wait up to 6 days between cardiologist exam conducted in the doctor's office and the treadmill exam conducted in diagnostic lab. The action was after observing the flow of patients from the cardiologist's office to the diagnostic lab. Two physicians decided to see the patients in diagnostic lab itself. So now patients make appointments to see the cardiologist there. The daily schedule for diagnostic exams was changed so patients could get both exams done on the same day. So most of our processes, unfortunately, are designed keeping in mind the staff of our hospital, the physicians in mind. In fact, you have to keep patient in mind. You have to design your processes as per the patient's requirement. And when you do that, suddenly, like this hospital, initial diagnosis to exam time was for treadmill exams was reduced from 2,000 minutes to 64 minutes. So few days to few hours. This is what transformation is about in process improvement. So there are so many examples. I just wanted to give few. You can reduce a lot of signatures, a lot of approvals. See, any approval is not adding any value to the system. Unfortunately, this is true. We think that approval is very important, but actually all the approvals can be done away with. Approval is not adding any value. See, why the approval was required? See, 10 years ago, the technology was not so advanced. Okay, just think, what does the approver do? What exactly he does? He actually takes the responsibility of the errors. Yeah. So what we want is two people, one person should check, 2% should check, 5 people should check. And you will see that when you commit more mistakes, you will add on checks and inspections. Why do you commit mistakes? Can you reduce those mistakes? can you work on reducing the errors and mistakes to zero? When you have zero error, there is no requirement for checking. Then there is no requirement for approvals. So all these mindset change has to happen as a quality person. We try to bring in during our sessions. Idea is to eliminate waste and create value in the system. So first you identify the value. And once you identify the value, then focus on only value adding steps and try to reduce non-value adding steps. That's the whole idea. So we first map the process, identify which is value added, which is not value added. Yeah. And once we identify the non-value added steps, we try to reduce and eliminate them. Okay. So let me give some examples rather than just talking about theory. Unnecessary process motion, unnecessary waiting time, errors, unnecessary transportation. These are all wasteful steps in our hospitals. A person who's underutilized is a waste. Person who was overburdened is also a waste. Like if you tell the nurses to do 2 shifts, in the second shift, the probability of committing the mistake is more. So one waste leads to another waste. You commit mistakes, then you rectify those mistakes. It is a bigger cost to the hospital rather than hiring a new nurse. So these are certain things, certain mindset change leaders have to develop. And that's what some of the CPHQ topics are all about. Any equipment which is not utilized, underutilized equipment is a waste. On a funny note, like cost of 5-minute walk, empty walk is a waste. Even walk to elevator and elevator wait, and you add on elevator travel, walk to lab or pharmacy. So everything, that's cost per hour. If you look at many of our work has been in UK or US, so I'm just trying to give it. These are generic examples, but again, 50 to 60% of my the trainings have been in the Middle East. And somehow I don't know, it was never designed like that, but like 15, 17 years, I've been into most of the time I ended up doing training programs and consulting for hospitals in Middle East, and not only hospitals. I've got other clients also in different industries. So this is about a hospital. Like a nurse cost per hour is 50, and if you go on calculating cost of 5 trips per day per nurse is 25, and if you have got 200 nurses, you can imagine what could be the cost of poor quality. Or see, these are all costs which are not adding any value to the system. So in multiplied by 200 nurses, multiplied by 365 days in a year, ends up into a few hundreds of thousands of dollars. And these are all hidden wastes. Lab and pharmacy on second floor and radiation equipment in ground floor. So there is a lot of movement waste, lot of to and fro movement. This is all wastes. Why not have everything on the same floor? Reduce the non-value-added activities. Eliminating the exam room interruption. Any interruption is a waste. Okay. So any fluctuations, like you have, you can, this is a typical, many hospitals, have this display of performance. Patients are waiting to get admitted, and the discharge of the patients is happening in the afternoon. Okay. So that waiting time of the patients increases, right? So Glory, you have a question? Yes, please. You can write in the chat box. Yeah. Or anyone has a question, you can write in the chat box, and also you can write in the Q&A as well. Okay. Yeah. So what we are doing here is we are trying to identify these wastes due to imbalancing of our operations. Patients are waiting, and we are still waiting for the patient to get discharged. Why can't you reduce the discharge time? So again, some visual controls which could be applied. See, alert on error-prone products. We can use some techniques, visual controls, which will reduce our errors. Indented surgical instrument tray, a visual hospital. Here, indented surgical tray means it is going to prevent the mistakes of forgetting something during the surgery. The visual hospital means if you go to the hospital, the patient should not be asking any direction. See, asking or seeking direction is a waste. Everything should be crystal clear. It reduces a lot of wasteful time. If you have, like just a day-to-day example, rice cooker, it stops if it overheats, isn't it? This is known as mistake proofing, also known as poka-yoke. Poka-yoke in Japanese means mistake proofing. Even by mistake, you cannot commit a mistake. Automatically, the equipment gets switched off. So this can be easily applied to our healthcare also. One example could be the smart machines, which cannot be set or operated beyond normal, safe, or maximum levels. So that is again example of waste. So Banan is asking, do we need to buy a book or for a CPHQ exam, or the course is enough? Course is enough. You don't have to buy any material. See, we have actually prepared the material from the NHQ book only. So we have got those things with us, and based on that we have created the material, so you don't have to buy anything. And we take you through the different situational questions, all the questions related to the CPHQ syllabus, and we prepare you well for the CPHQ examination. And our passing percentage has been very, very high. It is above 90%, so which is very, very high for any institute. And we are one of the most well-known institutes, just to answer your question, Vanan, who have got lots of, in fact, yesterday only, Dr. Kuri's Knight from US, she told us that she has passed the CPHQ examination. Similarly, we have got a lot of people working in Dubai, Abu Dhabi, a lot of nurses in Saudi Arabia, a lot of physicians in Saudi Arabia, Qatar, UAE, they have passed the CPHQ examination. But just by attending our sessions, you don't have to really buy any material. Our course is enough. If you are interested, we will, maybe my team can write, if you can give a link here of how to register for the course. My team will be happy to give that link, and you can always register for our course. I'll tell the details of our course after a while. So yeah, some of the abnormal values will be rejected. You cannot connect oxygen to nitrogen because the connections themselves are different, right? So this is an example of poka-yoke. Now, these are quality tools and techniques to prevent errors, to prevent mistakes. Like other examples could be fixed number of packages during the surgery, a complete catheter kits for insertion, prepackaged medication cart with correct dosage. These are all, again, examples of poka-yoke. Poka-yoke means mistake proofing. Okay. Now let us go to the little analytics part. So do you agree that some of the things, in fact, I told you what Deming said. Another interesting quote of Deming is, you cannot improve if you cannot measure. So let me ask you, can you measure everything? Or do you agree with this? Some things can be measured and some things cannot be measured. Just let me know. Okay, so Deepika Patel is telling that everything can be measured. So it appears you have attended my training program. Yeah, so everything can be measured. Yes, you're right. So now how? Yeah, how? That's what how. So you cannot improve if you cannot measure, and you can measure everything. So there are two types of data. Continuous data and attribute data. See, first of all, when we think about data, we have got some people say, I don't collect the data, or I don't want to get rid of the data. Some people say, I'm not comfortable in giving you the data because you will do some graphs and charts and reveal my inefficiencies to the whole world. So means I'm afraid, like you're asking me data of the errors in my department. That means, you are making some report which will put me in trouble. So I don't want to give you the data. But what if someone tells you that he or she is there to help you to reduce the errors in your department? Then you will be happy to give that data, right? So you have to also, as a quality professional, you have to seek the data with proper approach. You have to tell the people that you are here to help them. Then only people will give you the data. Some people say we have too much of data, but I don't know what to do. So today you will learn. Now I'm going to show you how you can analyze. How easily you can analyze. See, nowadays you have got tools and techniques. Everything is automated. Now, CPHQ is not going to test you in those, how to do it. It just expects you to know that some things like these exist, and you should have access to these things. You can recruit staff. You can hire people who are those experts. But as a leader, as a quality professional, you should be aware of what is happening in the healthcare industry. So I will show you some of the glimpses of that. Another thing, it is not related to CPHQ. I have given in International Medical Center, I had given a lecture on AI and data science applications in healthcare. I strongly recommend you please watch that video. It's a 2-hour video. By the way, it is not related to CPHQ. I'm just those who are interested to know what's happening new. Nowadays, you must be hearing about AI, data science. And we do a lot of work in AI and data science in healthcare. I'm also on the board of advisory of some of the AI and data science applications ministry of 2 countries. So that 2-hour lecture will definitely help you to understand what's happening. What do you mean by AI, artificial intelligence and data science? You'll get a very good idea about these applications in healthcare, and you will be like, I would say you'll be in tune with the times. Yeah, fine. Now coming back, we have. Some people say data analysis is too complicated. So it is not at all. So let us understand there are 2 types of data, continuous and attribute data. Okay, Baran is asking, when is the nearest CPHQ examination? Nearest CPHQ examination is actually, for you it will be June, last week of June. So last week of June, and our course is starting. I'll tell you the dates also. Can my team tell me the date? The dates in the examination, yeah. So my team has already put in the link of AI and data science in healthcare. This is AI and data science and healthcare, right, Naveen? For the
Yes, sir, that is it.
Yeah, fine. Right. So AI and data science I just you can just watch whenever you want. Okay, so now coming back, I will tell you the dates also. My team, if you can just tell me the next dates available of our CPHQ training. And the CPHQ exam is in June, last week, generally last 2 weeks of the June, generally they schedule. They schedule in March, end of March, end of June, end of September, and first few weeks of December. So this is usually, the These are usually the exam dates. And you can write the exam from your home also. Okay. You can write the exam from your home also. Okay. So now coming back to the learning part. We have two types of data, continuous data and attribute data. What do we mean by continuous and attribute data? Continuous data is about continuous data is something which I can represent on a number line. Something which can be represented on a number line. Now, what do we mean by that? Number line is a line which goes from minus infinity to plus infinity. It means any point on that line, like 23.646. Patient waiting time, 22.63 minutes. So you have a unit and you have a decimal point. Yeah. That is known as waiting time. It's continuous data. Patient discharge time. Discharge time of patient. 2.3 hours. Okay. Now, attribute data is something which we feel is difficult to measure. Like, for example, can you think of anything in a hospital which is difficult to measure? And I'll tell you the way. I can tell you the way how you can measure the same thing. In fact, I will tell you the generic way, the generic solution. And you can apply this to anything in your hospital. Yeah, so Kauthar is telling that, is it enough to pass the exam? Yes, this course is enough. This course means 4 days to 5 days training is enough. In fact, 4 days training is enough. We conduct a 4-day training, and you can attend as many days if you want. Like next batch, you can attend as many times till the time you get the confidence. In fact, in the first course only, you will get the confidence. And this 4 days, which is generally happening on a Saturday. Usually we do training programs on Saturdays and you can attend them. These 4 days over the 4 weeks, you get prepared for the exam and that's enough. That's it. Yes. Okay, now, let me go back to this. So Santosh is telling questions counseling, Arav is telling patient dissatisfaction, and Srinivas is telling patient dissatisfaction. Yes. Santosh is telling good evening. Yes. Okay, good. Good evening. Yeah, Santosh. Thanks for joining. So we are starting the session on March 11. For your information, coming Saturday, we are starting a new batch. So do join us. Okay. We're starting a new batch. So the attribute data. Patient satisfaction. So I can easily create minimum 2 categories of whatever I want to measure. Categories is satisfied, dissatisfied. So one trick to measure anything, whatever we want to measure, is create minimum 2 categories, which is presence or absence of that attribute which you are trying to measure. What we are trying to measure? We are trying to measure patient satisfaction. So what are the 2 categories? Presence of patient satisfaction or absence of patient satisfaction, means satisfied and dissatisfied. Now try to apply this to anything which you want to measure, and you will get your measure. Put it like a pain, no pain, yes pain. Or you can have a scale also. Like here, I could have had 5 scale: highly satisfied, satisfied, neutral, dissatisfied, and highly dissatisfied. But still, they are also categories. Okay. Although I can assign numbers to them, 1 to 5 scale, but they are still categories. Please remember, they don't become continuous data. Continuous data has to have a unit. Continuous data has to have a possibility of a decimal points. But here, you will have a count. So out of 100 patients, 60 are satisfied with my services and 40 are dissatisfied with my services. That means proportion means out of 1. What is the portion in 1? Proportion. So here it is 0.6 and 0.4. Proportion. 0.6 and 0.4. This is known as proportion. And then comes percentage. Out of 100, if this circle is 100, out of 100, so this is 60% and this is 40%. This is percent. These are all measures. Okay. I hope you are with me up till here. Yeah. There are 2 types of data, continuous and attribute. Now, how to deal with continuous data? How to deal with continuous data? Continuous data, first of all, when I collect any continuous data, I have to display. I have to tell the whole world how am I performing. Like discharge time. Discharge time. Most of the time, I discharge in 4 hours. Sometimes it is 3 hours. Sometimes it is sometimes it's 5 hours and sometimes it's 6 hours. Sometimes it is 3 hours. Sometimes it is 2 hours and sometimes it is 1 hour. So how many times I discharged? This out of 100 patients, like 40 patients, I discharged in 4 hours. Around 30, I discharged in 5 hours and so on and so forth. So what's happening here is I'm making a frequency chart. How will I make a frequency chart? Historical graph. I collected the data of my patient discharge times in the last 1 month, and I make a chart telling that this is how my process behaves. And typically you will find almost all your continuous data like waiting time, discharge time, blood pressure of patients, age of patients coming to your clinic, they are all following these types of distributions. Any continuous data will follow these types of distributions, and this probability distribution is known as normality distribution. Normal distribution. Normal distribution means it is normal to obtain a normal distribution. Like as I said, time taken to perform a surgery. If I collect 30, 40 samples of surgeries, you'll find that, it is taking most of the time, it is taking 60 minutes, sometimes 70, sometimes 75, 80, but never goes beyond 80 and never comes below 40, 45. This type of distributions exist in our system. I have to just collect 30 samples. I have to just collect 30 samples, and this will give me maximum information about the whole process. That's the magic. That's like a secret. It's nature's secret, you can say. What is that? If I collect 30 samples from any process at random, like let's say I want to, let's take an example. Let me continue with the example, patient discharge time. How, and I will solve this problem also in our hospital using some tools and techniques. And in the whole journey, we will learn some tools and techniques. So I think half an hour to go, right? My team, just let me know, because sometimes I lose track of the time. I keep on going. So I'll accordingly, I'll structure my program. So in the next half an hour, you are going to learn a lot of statistical tools. Please be ready to learn that. And they are all high-end statistical tools and all part of your CPHQ syllabus. Okay. And this is the area where most of the people, they just, they say, oh my God, this is a normal distribution or control charts. I can't, I've run away from there. It's easy, actually. It's the easiest part. Sometimes I feel it is easier than the leadership model, which people find it much easier. Patient safety, they say, oh, it's so easy. We know we can, pass that. And in fact, patient safety questions, everyone passes. They're very, very easy question. Easy means, they about it. But the data analytics is like sometimes it's a totally new subject for some of you. So that is why. So we focus, especially in our training programs, we really focus on it. We also give you all the recordings of our training programs. Whenever we interact a lot. Now this is like a lot of people are, attending this training program. So I cannot have everyone on the panel right now, but when we are doing the session, generally it's around 15 people, not more than that. Okay, we generally take only 15 batches. If some more people are there, we request them to come in another batch. So, but we keep it because interaction happens. Otherwise, if you got, let's say, a lot of people attending the session, then it's difficult to interact individually. So my generally, the way we do it is like we interact a lot. And you have to ask the questions. If you're not understanding, you have to ask the questions. So now coming back, this is our histogram. And this is only for continuous data. Okay. Now let us look at attribute data. I cannot make a histogram here because it will never follow normal distribution. In fact, let's take satisfied and dissatisfied. Here I will make a bar chart. Bar chart like satisfied, dissatisfied. If I have got 5 categories, I will make 5 bars. Highly satisfied, dissatisfied, neutral, etc. Or I can make a pie chart. So the pie chart or bar charts are for attribute data. And whenever you are dealing with attribute data, you should always talk in terms of proportions. Okay. And some of you, those 20 people who have joined today, who have attended my training sessions of Green Belt and Black Belt Six Sigma, they must be knowing when we deal with attribute data, we talk about proportions test, 1 proportion test, 2 proportion test, and chi-square tests. Okay. And when we are dealing with continuous data, we talk about t-tests, 1 t-test, 2 t-test, and then ANOVA. I hope you still remember. But anyway, let's not deviate from the topic. Okay, coming back. So there are 2 types of data. Now I know how to display my data. No, I'm not here to display the data only. I'm here to solve the problem. as a quality professional, you are not expected to only check like, oh, your commit a mistake, your infection rate is 2%, you are making a chart and graphs. The quality department is not only for that. Quality department is there to solve the problem. How to solve the problem? How do I solve? So you have to do root cause analysis. Now, before I go to the root cause analysis, although time is a little less, but still I'll try to do a little fast. But let us understand, before I go to the root cause analysis, where you can use cause and effect diagram, Pareto analysis, box plots and scatter plots, which I will talk about after 5 minutes. But in the next 5 minutes, let me tell you one more thing. And what is that one more thing? Every process, like say, suppose let's take an example of discharge time. As I told you, the process follows normal distribution. Normal means like a bell-shaped curve. So let me describe this a little bit more. Mr. Gauss, he found that all the repetitive process, Mr. Gauss, Carl Friedrich Gauss, that is known as Gaussian curve also. 17th and 18th century, he studied this curve for many years and found some strange quality. That every process, every repetitive process, if I take patient discharge process, every repetitive process has got an average. We present this as X bar. X bar means mean, average. Average is 30, let's say, patient discharge time is, let us say, in minutes. If I talk in minutes, how many minutes? 30 minutes means around 5 hours. Yeah. Typically, hospitals have 5 hours they take. In the morning, patient knows that you are going to be discharged today at 8 a.m. And then after 12 noon or 1 p.m., he goes out of the hospital. It typically happens, right? So it takes around 5 hours. And standard, so also one more thing he found, Mr. Gauss, he found one more thing. It has got something called a standard deviation too. Standard deviation can be easily found. Now I've got a very good video on theory of standard deviation, how we derive the formula for standard deviation and all that stuff. This I will not tell you in this program, but if you are interested in knowing that, I'll give you the link. What is standard deviation, how to calculate standard deviation, and how do you derive the formula for standard deviation? That also I have revealed. But, because this is a very introductory program, I'm just keeping the things a little simple. But trust me, calculating standard deviation is very easy. Very easy. It's not difficult. And nowadays, you go to Excel sheet and you will be able to easily calculate. If time permits, I will play that video after the session is over. Still, if you can wait for another half an hour, I will answer these questions. But right now, please trust me, that's very easy. It is very easy to calculate the standard deviation. Let's say I calculate the standard deviation and that is 30 minutes. So this is 300 minutes, or I'll say 5 hours, and this is 0.5 hours. Okay, we can make it this way also. Unit can be anything. Now, an interesting thing Mr. Gauss, he observed. What was that? He observed that always, if I collect the data from any population, any given population, plus minus 2 times standard deviation, will contain 99% of the total population. 99% of the total population. What do we mean by that? So suppose I want to know, let's say there are few billion people in the world today. What is the pressure, blood pressure of whole world? I want to know the range. What I have to do, 30 samples I collect at random and get an average and get a standard deviation, which is a standard deviation, as I said, very easily can be calculated. In Excel sheet, you can calculate. But if you are interested in knowing the formula, There's a formula also. My team has already put. You can just watch this at later stage. It gives you step-by-step way to calculate the standard deviation. By giving an example also, it tells you what is standard deviation. Standard deviation is actually average deviation from the mean in a way. So what Mr. Gauss found, 99% or 99.73% to be more precise, is lying between -3 times to +3 times the standard deviation. So let us take an example. I collect the data of, let's say, a hospital. If I go with the minutes, I can either take minutes or I can take hours. What you are comfortable with, you tell me. I'll take that example. You want minutes, or you are okay with the minutes, or you are okay with the hours? The calculation remain the same. So let us take, if I don't get an answer, then I'll go with the hours. Let's take hours. Okay, yeah, Arav is telling hours. So averages, so I'm just taking writing here. Average is 5 hours and standard deviation is 0.5 hours, right? Half an hour, right? So here it will be 5. What will be one time standard deviation? 5.5. What will be 2 times standard deviation? 5 plus 2 times 0.5, right? Which is 6. And what is 3 times standard deviation? 6.5. I hope you are getting it. Please ask me any question if you are not getting it. -1 times standard deviation is 5 minus 0.5. This is 0.5. This is 4. And this is 3.5. So I can say that in my hospital, the patients wait when they are waiting for the discharge from the hospital. They wait, minimum they wait for 3.5 hours and maximum they wait for 6.5. We call it as lower control limit and upper control limit, LCL and UCL. Lower control limit and upper control limit, LCL and UCL. Okay, I hope you are with me. So how do I get my control limits? Okay. See, nowadays it's very easy. If I, there are a lot of tools. We give you this tool also, which I'm showing you. But right now, don't worry too much about this tool. In Excel sheet also you can prepare. So, I reveal one patient got discharged in 4 hours, 5 hours, 6 hours, 5 hours, 5.2 hours, 4.2 hours, 5.1 hour. 4.9 hours, 5.7 hours, 5, okay. So I've just put 5, 6 example. In Excel sheet also it's very easy, but let me use many tabs. There's so many. This tool also we give it to you. So this is how, sorry, I chose just give me 1 minute. Yeah. So this is how I just put a few terms, a few samples. Actually, I should collect 20, 30 samples. So this is how it looks. Mean is 5 hours approximately. 4.9 is 5. And standard deviation is 0.6, which is 0.5. And let's take 0.5. So this is very easy. Nowadays, in Excel sheet also you can put and you can ask. Please go with me. Means if you want, I can show it to you, but it will take away some time. I can even show it to you, if you want. It's very easy. Put the numbers and ask for standard deviation. Okay. Put these numbers. Okay, I'm just putting some numbers. And is equal to average calculate the average of this. I just put some random numbers, okay? It's 5.5 and standard deviation is equal to STDAV, standard deviation. Very easy. 0.8, so very easy. Just put the numbers, you'll get average and standard deviation. But what you should do with the numbers, that is important. I can predict all my patients during the whole year. This is the way I operate. In this hospital, average is 5, standard deviation is 0.5. So I can predict my control chart. This is known as control chart. And the questions will be there, control charts, histogram. Histogram will be shown to you and, you'll be asked a question about it. A control chart will be shown to you. You'll be asked a question about it. This is known as control chart. Lower control limit is 3.5 hours. Upper control limit is 6.5 hours. So almost no patient, 99% of my patients are discharged within these times. And this is how my hospital patient discharge process behaves. This is also known as voice of process. This is known as voice of process, VOP. This is how my process is. Okay. And you will get this recording, whatever I'm revealing, you will get all this recording. If you just attend full program, another 20 minutes to go, attend this program, you'll get the recording. You will also, if you want a certificate also, you can get. I will tell you all the details in a short while. In the Q&A, my team can answer some questions in Q&A. Because I'll take some time to answer individually. So this is known as control chart. And control chart means what? Control chart tells you processes under control or not. So if you are behaving between 3.5 to 6.5, you'll say process is stable. Stable, it is under control. It doesn't mean that process is good. See, process under control doesn't mean process is good. Process under control means, like if you go to this hospital, 3.5 hours to 6.5 hours is my natural time. It will not go beyond 8 hours, and it will not be 2 hours. It's predicted. It is predictable process. It's a stable process. But what if I am doing, suppose one patient took 9 hours. I will say for my hospital, this is little strange. There is a special cause. We call it a special cause variation. This is known as special cause variation. And here we say this is a common cause variation. Common cause means a lot of causes are acting on my system and producing this variation. Special cause means there is one special cause which is affecting. I can reveal that, why it happened. Maybe the patient relative went home and we are searching for the patients and they came back, then the patient could be taken. This was a special cause. It doesn't happen regularly in our hospital. So the special cause are of not much significance to us. As a process improvement specialist, we are interested in the common cause and in the control elements. This is a major mistake leaders commit. They don't understand the difference between common cause and special cause. So they sometimes operate within the common cause, or sometimes they are always worried about the special causes. They start all their improvement problem. There's all this problem. Why this happened? Tell me what happened. No, you spent so much time here in 9 hours. That rarely happens. That's a rare event in a hospital. Forget about it. No, I'm not saying forget about it. It means you have to take immediate action. Sorry, I should correct myself. Actually, special cause, the line of action is immediately you should take an action. Immediately. Call an emergency meeting and solve the problem. And for common causes, don't call an emergency meeting. It will not solve a problem. You have to take improvement projects and change your control limits to new control limits. Maybe 1 hour to 4 hours. Change your control limits. Now, your new control limit should be LCL 1 hour, UCL 4 hours. Even this is also not good, but at least this is an improvement. So you take up an improvement project like Six Sigma. If you want to know about Six Sigma, please attend my Yellow Belt session. My team will put a Yellow Belt link also. This is a 2-hour session. You can watch that. This is the recorded video. I keep doing Yellow Belt session every 2 weeks. In the next program, you can come and attend, or you can watch my recorded video of the last few Yellow Belt training programs. Anyone, go to the Anexas channel. It's a very, sorry, I forgot to tell you. Please subscribe to my channel, Anexas Europe. Anexas YouTube channel. Name is Anexas YouTube channel. Just subscribe. Every day you'll get two tools. I keep talking about Lean Six Sigma tools and techniques. If you want to know about any tool like failure modes and effects analysis, all CPHQ tools and techniques, cause and effect diagram, Pareto analysis, there are so many tools and techniques are there. Please have a look. I have explained all the tools and techniques very much in detail with examples. And if you watch that, this one tool, almost every day, almost every 1 or 2 days I put, whenever I get time, I put all these tools. Like control charts, I'm telling you, but in control charts, in very nice video, with nice suit and everything. And I'll explain, I'll tell you. The same concept I have told using day-to-day life example in a video. I'll just demonstrate. As a revision, I'll demonstrate to you. But now, right now, I'm in the teaching process. Sometimes we have to be a little slow. So what I was trying to tell you, common cause variation means, suppose if I ask you, why this patient took 4 hours and why this patient took 5 hours? The answer will be, it is common cause. Don't seek answers. Don't look for, like, why this 4 hours and why this patient 5? Please forget it. It is due to common cause. Common cause means there are so many causes affecting. Make a cause and effect diagram. Discharge time is getting affected by so many causes. This we call it as Y. Always on discharge time, which whatever we are trying to improve, we call it as Y in process improvement. And what are the X factors? These are the X factors. X factors. Which are like discharge time is discharge summary time. Discharge summary was, took time. Or reports were inaccurate. Some report error were there. So it took time to, correct the report. Or some hospitals have insurance delays. So there are so many things. So many. Staff is not available. So many things. These are all affecting my system and producing this variation. And this variation, we call it as common cause variation. Now, how to deal with common cause variation? You should do an improvement project like PDCA, Six Sigma project, which we follow DMAC, define, measure, analyze, improve, and control. I will quickly show one DMAC project towards the end, I think. Now, hardly 10 minutes are remaining. If you allow me a little bit more time, I can show you a project also. But let me first reveal some of the things. So here, cause and effect diagram is going to tell you what are the causes of my problem. But why I am at 5 hours, average 5 hours, I would like to reduce it, isn't it? So I have to find root causes. So I can make a cause and effect diagram first. Reporting errors, discharge summary time, so many things. Discharge summary time. Now, if I say discharge summary time created by discharge summary time, is delaying my patient discharge time. I have to prove it using data. So what I have to do? I have to collect So discharge summary time, I took half an hour. Patient discharge time was 3 hours. When I take 1 hour, patient discharge time is 3.5 hours. When I take 2 hours, patient discharge time is 4.5 hours. When I take 2.5 hours, patient discharge time is 5 hours. When I take 3 hours, patient discharge time is 5 hours. So it says, whenever I'm dealing with, this is continuous data. I hope you remember what is continuous data. When I'm dealing with continuous and continuous data, I will make something called as scatter plot. Patient discharge summary time and total patient discharge time. So you can see as there's a positive relation. Positive means when one increases, another also increases. It's a positive relation. So I will say, yes, discharge summary time is the root cause. And I will investigate. I will improve my process. I will do some brainstorming sessions. There are a lot of brainstorming sessions. One of my favorites is 635. 635 technique. Please watch this 635 technique video. See, I'm giving you a lot of videos, like a lot of homework, right? Homework means just look at the videos and you'll find 635 technique is a very good idea generation technique, and you can solve your multiple problems using the 635 techniques. Please watch this 635 technique, brainstorming technique called 635 technique. It's a superb technique. So how to reduce my discharge time? You can use 65 technique to generate some real good solutions. But suppose this was not the case. Suppose your data was something like 0.6, 0.7, 0.8, 0.5. So you always take 5 hours, 6 hours, 7 hours, but patient discharge keeps varying. It has nothing to do with the discharge summary time. Discharge summary time is not the root cause of my patient discharge time. So something else is the root cause. Maybe let's say, staff availability. Staff available, not available, not available. So when the staff is available, I discharge the patient in 2 to 3 hours. When the staff is not available, I discharge the patient in, let's say, 4 or 5 hours. So staff available or not available is attribute data, right? And patient discharge time is continuous data. Now I want to investigate, do a root cause analysis. Is staff availability affecting my patient discharge time? Is it available, not available? Available, patient discharge time is low. When it is not available, patient discharge time is high. Okay. In this case, yes, staff availability matters, and I'll ensure the availability of staff. But what if I get something like this? Staff is available or not available, still I'm taking 4 to 5 hours. Available, not available, still I'm taking 4 to 5 hours. This is known as box plot. This is a tool, actually. It's a display, but it is a display of any particular data. When you collect, you can display using box plot. If you want to know about box plot, that also video, I'll give it to you. There's a video which my team will put. What is a box plot? But right now I'm giving you the overview, bigger picture. So now I will look at this data and say, well, the staff is available, not available. This doesn't affect. So I'll say, don't blame the staff availability for the late patient. So I'm making data-oriented decision and solving them. Okay. By the way, whenever you complete our session, you also get some videos. Like, for example, we have got multiple videos, and when you join our session, you'll get all the videos. Let me show you, I think, because I've covered one, let me show you uh, the concept of control chart, I have explained using a simple technique. Yeah. So same thing, I've using patient discharge process. I've taken a
Time from my home to office.
so I'm traveling from my home to office every day. I collect the samples 30, 32, 28, 33, 27. These are my minutes. And if I say,
And I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be minus 3 sigma limits. That will be 15 minutes. And upper control limit would be 45
I
minutes.
hope you got how I'm getting 15 to 30, then 35, 40, right? I hope you are able to correlate with this. This is 35, this is 40 and 45, right? This will be 25, 20, and this is 15.
That is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes. Means all the causes are acting on my system and producing this variation. This is known as voice of process, as if my process is telling, my traveling process is telling that I will take between 15 minutes to 45 minutes. Now, if I take 60 minutes to travel to my office, then same question is asked to me, that why did I take 60 minutes? Then my answer won't be that all the causes are acting on my system and producing this variation of 60 minutes. I might be able to point out a cause. We call it a special cause. So I may say that I took 60 minutes because maybe today there was too much traffic on the road, or it can be any factor. So when I go out of control limits, I can specify a special cause, and we call this variation as a special cause variation. So we have two types of variation: common cause variation and special cause variation. Common cause variation is part of the process, part of the natural variation of the process, and special cause variation is assignable variation. I can assign a cause to that particular event. Now, what is the difference between common causes and special causes? For special causes, you need to take immediate action. Means you need to take a prompt action so that you are able to bring the process within control. But for common causes, you should not take any specific action. Usually, the common cause is within the control limits, and if you want to act upon the common causes, you might have to change the control limits, and changing the control limits takes effort. You may have to do a DMAC project. You may have to do a Lean project. You may have to do a Six Sigma project. And that's what we are doing. That is why we say that Lean and Six Sigma is applied to chronic problems. A process is behaving in a certain way. It is behaving within some control limits for a long, long time. Last 6 months or 7 months, your procurement time has been, say, 120 days plus minus 30 days. And I would like to change the control limit. I would like to change the DNA of my process. And that is why I would need to do a Six Sigma project. To understand the variation.
So I will show you a Six Sigma project done in a hospital also in a short while. But before that, let me also, a lot of people are asking about the fees, etc. So these are the topics which we cover. I already told you. You can always have a look at that a little later. And these are the training timings on Saturdays. And you will also get Lean Six Sigma Yellow Belt certificate along with the CPHQ. If you get CPHQ trained certificate, you will also get, in fact, you will get 3 certificates when you attend our sessions. You will get CPHQ trained certificate. You will get CHQE certificate. You will also get a Six Sigma Yellow Belt, because all the topics of Six Sigma Yellow Belt are also covered in our CPHQ sessions. These are the timings. And I'm waiting for you to join my next session, or not next section, then at least April. So try to join as much as possible. As I said, you join now. Once you join our course, you can attend every month we have a course. You can attend as many classes of any batch in the future. So it's all totally free for you. And also you will get all the recordings as well, and you will be able to ask questions anytime. Not only in the classroom. If you think of a question in your day-to-day work, you are facing some difficulty related to quality, we will be happy to answer you, and we'll be happy to. We all some project, as I was telling, like Lean Six Sigma project, DMAC project. Also, FMEA I was talking about, but as I told you, as I predicted, due to lack of time, I can't teach you FMEA, but I will give you FMEA full toolkit along with the FMEA template and full explanation of FMEA. This is the link of FMEA. You can just go through that. So I'm giving you around 1 more hour, 1 to 2 hours of more additional content. All these tools and techniques are part of your CPHQ syllabus. Whatever links I have given you, they're all part of the CPHQ syllabus. Failure modes and effects analysis, very, very important tool. Very, very, effective tool to solve any problem in our healthcare system. FMEA. So just now I told about some of the tools. So here, let me talk about some root cause analysis done using define, measure, analyze, improve, and control of our FMEA. Link is given, by the way. My team has just given, so please have a look. I'll request my team, when you're sending the email, can you provide all these links also, useful links? In the email, please provide useful links. That will really be beneficial. Please change the format of our email. Please ensure that tomorrow, and just confirm that we have done it. So Glory, Manka, you have raised hand. Would you like to ask any question? Please let me know. You want to come on the panel, or you want to ask a question? Just let me know. I'll be happy to welcome you in a short while. And you can also write in the chat box. If you have any question, you can write in the chat box also. Okay, so now coming back to the define. So this hospital wants to reduce the OPD patient waiting time. So when we are doing a project, first we write a project charter. We write a business case also, why I should be doing a project. Then we write a problem statement saying that, well, it is taking 90 minutes. Patient waiting time is on an average 90 minutes. And we would like to reduce it to 30 minutes by the end of, typically a Lean Six Sigma project take 3 months, 3 to 6 months, 3 months for green belt and 6 months for black belt. So there are 2 belts. The green belt means you attend 3 days of training, you become a green belt. If you attend 3 more days of training, you become a black belt. Now here you have defined, measure, analyze, improve to DMAC. When I'm going to complete my different phases. Define means you write a project charter, and you also write a SIPOC, supplier, input, process, output, and customer. So this is the customer, patient is the customer. Whenever you are making a SIPOC, you generally make it from right to left. So customer, output, process, inputs, and supplier. SIPOC, supplier, inputs, process, outputs, and customers. So when I'm trying to solve a problem, generally I have a systems thinking. I told you, right? Suppliers, input, process, outputs. So remember that system. In the beginning, I had told these are the process steps. This is the output, goes to the customer, customer. And then you have a strategy team. Then you have suppliers, then inputs. So supplier is from suppliers here. Input is for inputs. Process is for process. O means outputs. And C means customers. The CPHQ is actually derived from that. So if you have an output is a prescribed treatment. Process is the very high level process. What happens in the patient treatment process? What are the inputs and who are the suppliers? So definition of a problem from customer's perspective is that whatever is the output, the customer is dissatisfied about some output. Here, treatment, the time or the waiting time is one of the measures which the customer is dissatisfied about. And it could be due to delay in registration, delay in consulting the doctor, delay in receiving messages. There could be anything, or patient history is not available, registrant forms are not available, doctors are not available, receptionist is delaying. There's so many things, these are all X factors. These are all my X factors. Yeah. And this is the why. Okay, too much of spaghetti diagrams there. Okay, so then actually I collect the data, 20, 30 samples, and I find, well, my my waiting time is 90 minutes and standard deviation is around 5 minutes. So I can see what are my control limits, how my process behaves today. I can even make a control chart, and I will find the control process behaving stable, but it's not satisfying the customer. It's not satisfying the patient, but process is stable, process is under control. But process may be under control, but maybe it's not satisfying the patient. So I have to make it something here. That's what the intention is, right? So I do a cause and effect diagram and find what are the causes. Now, every cause may not be equally responsible. So we do a Pareto. Pareto means Wilfredo Pareto was an Italian economist who found that 80% of the money, 80% of the wealth in the Italy was with 20% of the people. So he called this the 80-20 rule. Now, Joseph Juran applied this to quality. He said 80% of your problems, 80% of your problems are due to 20% of, only 20%, maybe, this, or maybe, maybe this, only 20% of that. If we have listed 10 causes, 20 of them, 20% of them are responsible for the 80% of your issue. So which are those? So here you will find out these are the two root causes: time spent in registration and time spent for waiting for the doctor. These are the two root causes. Apart from, there are a lot of waiting times, payment, medicine related billing, there's a lot of, but these two are the most important, which are contributing to 80% of my total waiting time. So I will work on them. This is again application of Pareto principle. In our session of CPHQ, we will train you how to make a Pareto, a step-by-step method. And see, in the CPHQ exam, you will be given a Pareto, you will be given a control chart, you will be given a cause and effect diagram. So these things you don't have to make, you have to just understand, and you should be able to answer question quickly. See, and when you are actually getting a question, you have only 3 minutes to answer. So your fundamentals should be so strong that by looking at the graph, you know what is the answer. There is no time in making guesses, going back and trying. In our course, we make your fundamentals so strong that by looking at the question, you will get the answer. The 4 options, immediately the answer will come to your mind. And that's the kind of preparation we make for our participants. So here, we applied some tools and techniques. We did some brainstorming techniques. There are some basic ground rules of brainstorming. I will show you that also. There's a video for that as well, actually. Let me show you some video at least, cause and effect diagram.
Once we have
Pareto is
collected,
there, Pareto chart videos are there. Let me talk about, let's say, cause and effect diagram. Simple. Basic ground rules of brainstorming. Okay. When you are brainstorming, some ground rules. And 635 I have already told.
participants about the time, venue, topic well in advance. So they are mentally prepared for brainstorming. As I told you that brainstorming is used for either generating the possible root causes or getting the ideas to solve the problems. There are certain rules which need to be followed in brainstorming. The rules of brainstorming are: give equal opportunity to everyone who is participating. So tell them to participate, and you can use different techniques. As I told you, we will be learning in the improve phase. Capture all the ideas, so document all the ideas. Whatever is being discussed, whatever ideas the participants are given, someone should be there to document, or a scribe you can appoint to document all the ideas. Leave your designation and ego along with your shoes outside the meeting room. That means don't think that if you are senior, your idea carries more weightage. So obviously this ground rule should be very clear to everyone, and everyone should be encouraged to give an idea, and everyone's idea should carry equal weightage. There should be a non-threatening environment. When people are giving ideas, they should not be afraid of giving ideas. So you should create an environment where people should be encouraged to give the ideas. Also, we should ensure that wherever the brainstorming is taking place, there should not be any disturbance, so people are focused on brainstorming. Sometimes people might deviate from the topics. There is a tendency that some important issue crops up during the discussion, so at that time you can always create a parking lot saying that, well, this idea or this issue is very, very important, and we can park it to be discussed after a while once we complete the brainstorming on this particular topic. We should encourage people to fantasize freely. We should not put brakes on our thoughts. So you can give some out-of-the-box ideas, you can give some wild ideas, and if people are giving you wild ideas, they should be encouraged. If you give a specific duration of brainstorming, we should try to complete the brainstorming within the time duration, and defer evaluation. Now this is one of the rules which is often violated. People start discussing the ideas. Someone gives an idea and someone else says, well, it will not work in an organization. Or some other person gives an idea and someone else comments that, wow, it's a great idea. So don't evaluate. Reserve your comments for evaluation at a later stage. When you are generating the idea, when you are generating the root causes, they are not to be evaluated. You cannot say that it is a good idea or this is a very good root cause which you have thought of. No evaluation, just write down whatever is being suggested. Generate quantity, do not worry about the quality at the initial stages. So you have to generate lots of root causes, lots of solutions, more the better. A pearl diver, he dives into the sea to find the pearls. If he just collects 10 oysters, the probability of getting the pearl is very low. But if he collects thousands of oysters, the probability of getting the pearl is very high. So similarly, if you want to collect great ideas, some of the out-of-the-box ideas, some creative ideas, then definitely you should create more and more ideas. So how to generate those ideas? There are different techniques.
So one of the techniques I already sent it to you, 65, I told. So I hope you have noted down all the links. Like FME is a very powerful link. Actually, if you have only one, very limited time, I'll request you to watch that FMEA tool. And it's so useful. You'll definitely write back to me. If you use this FMEA, you'll get some so magical results. You will write to me saying, or please do write to me. Please connect with me on LinkedIn. I'm there on LinkedIn. So if you are also there on LinkedIn, just you can follow me if you prefer that way. Just click on the follow button and you can see a lot of tools. As I told you, I keep telling, I keep repeating the same thing, but I every day, every 2 days, I generally put some tools and techniques which will help you to know about quality or improve your quality in your hospitals or clinics. my team can put some of the CPHQ syllabus as some responses of our candidates of our training program. The Cedar Hospital CPHQ response, right?
Okay, sir.
Yeah. So you can, so some of the, a lot of people have attended our trainings and they have given a very nice feedback. Some of the CPHQ certified people have also given us the feedback. And these are some of them. So I'll just play some videos of
our last 3-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time on what really is of value for the examination, but more importantly as well because of the practical examples that Amitabh was able to provide us in our everyday healthcare work. One thing that I really benefited from the course is that Amitabh from Anexas was able to provide us with answers and solutions, especially at the statistical level, to questions and problems beyond the CPHQ course, to exercises and projects that we do in our everyday work life. For that, I would definitely recommend the course, taking it with Amitabh and Anexas. It's been a great experience, both for my preparations for CPHQ, but more importantly for my everyday work. Thank you so much.
Hi, so I've just completed 3 days training of the CPHQ, which has been absolutely fantastic. Amitabh from Anexa has been phenomenal. The course materials have been fantastic. I think what I really enjoyed about this was that I could relate a lot of this methodology to healthcare, and a lot of the examples were things that I could contextualize it with healthcare. So I'm from here in Qatar at Sidra Medicine, and so again, thank you to Amitabh for this fantastic training.
Hello friends, I'm Dr. Jyoti Bala and I have recently cleared my CPHQ examination with a wonderful score of 88%, and I'm really grateful to Mr. Amitabh Saxena and all his team. So Anexas has done a wonderful job training me for CPHQ exam. I could crack the exam pretty easily. The materials provided were very up to the mark, were very appropriate. I mean, I really had to work hard with them for a couple of months, but it wasn't that difficult as such, and I really wish all the candidates great luck, whoever are appearing for CPHQ examination, and I highly recommend Anexas training for the same. Thank you.
So there are many credentials like this, and I would like you to also be one of them. Our whole intention is to generate excellent credentials, and I'm looking forward to meet you in my sessions. Most welcome.
I'm Rekha, working with Dubai Health Authority, at present as CPHQ certified personnel. So now, to share my experience with you all, I'm indeed happy. Why? Because you have taken a good decision of joining Anexas. Anexas has really helped me for passing the exam. In fact, I appeared twice and I couldn't pass through, and with the attempt where I was trained and I got decisions from Anexas, I was able to pass the exam very confidently. So, to share my experience, I would suggest all of you to please go through the textbook in detail, and I personally prefer the Janet Brown book because it gives you in depth. An HQ exam textbook also is good enough, but if you are a good reader and you want the concepts to be more in depth, it is always good to have the Janet Brown book. After going through this Janet Brown book, you may please pace yourself to finish all the question banks which is shared by Anexas team. It is beyond our imagination. Plenty of questions are there. So in that case, so you need to schedule yourself to complete these questions before your exams. It is going to be really helpful for you. So once you complete that, please refer to the notes which you have taken during your session, and also special importance to the health data analytics. Why? Because you will get 30 questions, I believe. So in that you can score easily if you know the concepts of health data analytics, which is dealt beautifully by the Anexas team. So once you finish your Janet Brown book, the question banks and the health data analytics session which is shared, you are good to go. So while you schedule the exam, you have two options of either online or test center. Personally, I would suggest.
Now here we would like to tell that in fact she had appeared for the exam first, but she couldn't pass. She did self-study, etc., or I think somewhere else. But after that, she attended our sessions. She was easy. It was so easy to able to pass. So she was telling exactly how can we know what the questions they are going to ask. So we have a very good question bank also, which we share with you after when you attend the session. And we can't say that questions will come from the same question bank, but the questions are almost similar in nature. Whatever we give it to you, they are almost similar in nature. So yeah, on that note, any other questions you have? Any other? So looking forward to meet you soon. Yeah, and thanks a lot.